Well, hello everyone. Welcome to Principles of Clinical Level Self-Care with David Crow. I'm just popping in a few minutes early to help guide you and give you a little bit of a tour of the course homepage. So if you'd like to go to Floracopia.com, I popped the URL into the chat so you can copy paste that or just click on it and that will take you to the website. And then I'm just going to share my screen, the page. So you will land on this page, and in the upper right hand corner, you'll see here it says log in. And just click that button, enter the email address that you used to register for the course, and then you'll navigate to the course from there. And I'll jump over to the page you'll see next. So this is your course homepage. And so we'll be referring to resources that are here. And David has already posted a series of PDFs that he'll be sharing in today's class, and I'll just take a moment and show you where those things are. So this is the home page, and on the left hand side you'll see under my courses it says course home, which is this page that we're on now. And if you click on each module, so if you go to module 1, which is today, you'll see Principles of Clinical Level Self-Care module 1, date. To join the course, click here, and to submit your questions for David, click here. So if you have questions that come up throughout the week, this is the place to go right here. And then you'll see the PDFs just below. So that's a pretty quick tour. And I'm just going to go and check in with David again. For those of you who've just arrived, we're having a very quick, brief tour of the course homepage. I'll go back here for a moment. I've been logged, I'll sign out so you can see what it looks like. So to get to the course homepage, where all of your resources are for the course, you go to Floracopia.com, and then up in the upper right, you see the word log in. So just click there, then enter the email you used to register for the course, then click through, and you'll see under courses, you have the Principles of Clinical Level Self-Care course in your courses area. Click on that, and then you'll come to this page. Well, now it won't let me access. So all right, give us a minute. All right, so you can see here, here's courses. I click on courses, Principles of Clinical Level Self-Care, and then I land on my course homepage here. And today's resources are under module 1. I'll just point out a couple of things. If you'd like to come to the course homepage to access the class, you can just come here to join the course live, click here, and then submit your questions for David here. So if you have any questions through the week, be sure to come to any module and you'll see that option to submit your questions for David. And then you'll see the list of PDFs that David will be sharing in the class in this area here. All right, I'm going to go check in and we'll be back and ready to start in just a moment. Well, hello everyone. Welcome to Module 1 of Principles of Clinical Level Self-Care with David Crow. My name is Sherry. I'll be your host for today's session and for the course. We warmly invite you to submit questions as we go through the class through the Zoom chat. So the chat function is available at the bottom of your Zoom window. In a moment, I'll set it to host only. Please do send your questions to me at Sherry, and I'll be gathering the questions and adding them to a place where David can access them easily. We also warmly invite you to join us on video, and we'd also like to remind you that once your video is turned on, you can be seen by anyone in the session at any time. So please do turn off your video at times when you'll be moving or eating or when there are other distractions in your background to minimize distractions for everyone else. So to turn your video on and off, just click or tap the video camera icon on your screen. So if you're on a computer, it'll be in your bottom left. You might have to hover to find the icon. And if you are on mobile device, just tap your screen and you'll see the video camera icon at the bottom. So if it is open, it will be white. If your video is off, it will have a red line through it, or it will be red. So you also have the option to move between speaker view and gallery view. So to do that, use the button in the top right corner of your screen. It says view, so you can just click on that button, and then you can move between speaker view and gallery view. In gallery view, you can see everyone. On mobile, just swipe your screen back and forth. And of course, we recommend staying in speaker view during the teaching portion of the call with David. You'll be muted throughout the session until we call on you to speak if you've raised your hand. We'll get into that. I'll give more instructions once we get to the Q&A component of our call. And please do use headphones or a headset to minimize any background noise and to ensure the best quality sound for you and for the recording. And last piece, if the session should freeze up on you or if you get disconnected, start by clicking the Leave button in the bottom right of your Zoom window. iPad and mobile app users, just tap your screen. The Leave Meeting option will appear in the upper left. And then once you've left the meeting, quit all other programs and apps that may be running and use the same link to reconnect with the session. That usually clears up 99% of any issues. If that doesn't work, you can try shutting down and restarting your computer. And you do always have the option to join by telephone. All right, and now I would like to introduce David. So David Crow is a botanical medicine expert and the founder of Floracopeia. He's one of the world's foremost experts and leading speakers in the field of botanical medicine and grassroots healthcare. He's a master herbalist, aromatherapist, and acupuncturist with over 30 years experience and is an expert in the Ayurvedic and Chinese medical systems. So we are thrilled and full of anticipation. David, welcome.
Thank you, Sherry. And thank you for the overview and refresher course for those who may still need some assistance on Zoom, like me. So thank you for walking us through all of that. And welcome to everybody. And for those of you who have been in classes before that I have offered, welcome back. And there's a lot of people that I want to thank, and I'll just keep it very brief. I want to mention that this is the first time in quite a while that we have launched a course through Floracopeia. And unless you have actually done it, you don't know how complicated it is. There's a lot of people who've been working on this for a long time, and I just want to say thank you to everybody on the team who has been doing this. This is a lot of people to say thank you to. So thank you to all of you for making this course possible. And of course, it wouldn't be possible if you weren't all here. So thank you for the investment of time, energy, and money in this particular topic that I think personally is very important. So we typically go about 90 minutes, although those of you in past courses know that I rarely keep to that schedule, but I always answer everybody's questions. And if we don't get to all of the questions, or I should say, we rarely get to all the questions. And therefore, there will be a file that will be posted every week. And I'll just remind you of how that is done when we get to the question and answer session sometime much later tonight. And there are files that are posted. Sherry has told you where to find them. I will be showing those on a screen share. And I will be giving you homework assignments to do every week. There will be some things for you to study, look into, do a little bit of self-inquiry on. There's no tests or quizzes. These are just things for your own learning process. All right, I'm going to take a few minutes at the beginning and talk about what the course is about before we actually launch into Module 1. So what is this course about? It's about principles of clinical level self-care. Now, that's a big subject, and it is something that is still in a very early stage of development in my mind, but it goes back 40 years, okay? I'll just state at the very beginning that this is not a course on how to use herbal medicine for specific conditions, because people always want to know, what herb do I take for this condition? This course is about how to answer that question yourself. And that's a totally different approach. Now, when we look at that particular question, how do we answer these questions for myself? Then it will naturally open up discussion about broader categories of herbs. And there will be opportunity in every module to talk about some application of herbs. And there will also be the opportunity in the Q&A to talk about some applications. But I do just want to mention that this topic of principles of clinical level self-care will take all 5 modules to just define what it is in a basic way, to just outline what this topic really is. And that's why we have 5 modules, to look at the most important basic concepts. But just to sum it up very quickly, this course is about how to take care of ourselves. And we can all take care of ourselves with simple lifestyle routines. We know that. But this is about learning how to take care of ourselves with higher level routines, a higher level of understanding about how the body works. And a lot of times, this higher level of understanding is something that we would pay other people to tell us or do for us. And a lot of times, those people don't have as much knowledge or experience than we do. So what I'm proposing here is that we can do a lot of things. And this is increasingly important in this day and age of pandemic. And the resources are more available than ever. So that's one of the first definitions of self-care, clinical level self-care. And so in order to do this at a higher level, we need to understand why things are happening the way they are in the body, and that's diagnosis. Now, I'm going to give you a very extensive definition of diagnosis in a little bit. It is not, oh, you have this disease. My definition of diagnosis is that there are many, many factors and influences that are at work on us, and our health is a dynamic process of change all the time, and we can influence that flow of change. And the more we know and the more we apply, the more effectively we can do it. So that's more along the lines of self-care diagnosis. And the more that we know about cause and effect, the more conscious we are of what's happening in the body, the more effectively we can diagnose ourselves. So part of it is that we're actually going to be learning diagnostic techniques, like in this module, how to do basic blood analysis, things like that. But a lot of it is also just based on becoming more aware of what's already happening in the body. So a really simple level is, we know if our immune system is getting run down because we're not getting enough sleep. Well, that's self-diagnosis, okay? Or sometimes it's more complicated than that, and you need to ask somebody for some answers, like, why do you have insomnia? It's actually linked to deeper physiological processes. But that's the introduction to Module 1, because Module 1's about diagnosis. And so we have lots of tools available to us from Chinese medicine, allopathic medicine, Ayurvedic medicine, and the body is giving us the most information all the time. And so that's what Module 1 is about. Now, Module 2 is really learning about the internet and navigating the maze of internet medicine. That's a good phrase that has come out of this, internet medicine, and how to develop critical thinking. So we're not confused by what's out there, claims and marketing, and how to take this gigantic amount of information and make it relevant and personalized, okay? And so with skillful use of the internet, it can help us with self-diagnosis and with self-treatment. And that's the topic of Module 2. And the course is also about understanding and working with what's happening in this explosion of both allopathic innovations and natural medicine. So if we look at what's happening with medicine, what's happening right now is historic, actually. It's incredible that so much information is available and so much access to natural medicine is now available, and so many people are interested, and that allopathic medicine is coming up with so many improvements in its previously rather barbaric methods a lot of times. And so a lot of very positive developments are happening in allopathic medicine. And so the new form of medicine is really this integration of both systems. And what that helps us understand is that we can use natural medicine for what it is best at doing. And we can use allopathic medicine for what it is best at doing. And we can learn how to combine them. Now, in that process, there's all kinds of challenges, like the doctors don't want you to use herbs, or maybe you don't want to use the drugs. Well, how are we going to bridge this conversation? Okay, well, that's Module 3. And then we're going to have a module on the home pharmacy. And that's going to be where we talk about some basic groups of herbs and when they are quite safe to use, and maybe there's some contraindications, or maybe there's some herb drug interactions, and how do you fix a tea anyway, and all these kinds of things that people always ask about what to do on a practical level in your kitchen. That's Module 4. And then Module 5 is answering some of the questions and dealing with some of the challenges of some more complicated things. So this course developed over a very long period of time, even though I have really just started to articulate it in the last year. And there's 3 main influences I want to mention. The first is that when you do clinical practice for decades, then you hear a lot of repetitive questions and you see a lot of repetitive issues. So common questions, and I'm just making this course to answer all these common questions. So instead of answering the question one time for 200 times for 200 people, I'm going to answer it once for 200 people. And I'm going to tell you how you can answer it yourself, you see. So that's the main purpose of this course. Second main influence is that there were a lot of things that I have found in my own clinical practice. And so I'm sharing some of the, I guess you could call them pearls of clinical wisdom, things that I have seen over and over again. Common sense things, like don't take a medication without reading what it does, okay? It's amazing how many people don't. And then the third thing is really this evolution of what's happening in medicine from both systems and sort of merging together. So that's, those are the 3 main influences, but really what the most important factor was, about a year ago, it really became clear in my mind that there was a group of people that were starting to emerge that represented a different paradigm in medicine. And the original paradigm is the doctor knows everything and the patient just follows the orders. But that's happening less and less in a lot of ways for a lot of people. And that's because people now have access to so much information, and the limitations of allopathic medicine are becoming so well known now. So there's two types of questions that I started to hear a lot. And one question indicates that people have wildly unrealistic expectations about natural medicine. They think that taking turmeric is the counterpart to the strongest anti-inflammatory drug, and that they can just switch over. But it's not like that. And people have very unrealistic expectations about serious, complex, chronic inflammatory kinds of conditions that are happening, say, with their elderly parents. And they ask me, like, what herb will take care of this? Incredibly complicated situation. And my mother is 90 years old and she's on 10 medications and she's got all this stuff, long list. And it's like, what herb will fix it? That's wildly unrealistic. And we need to be realistic to really get the best results. So those situations are also an opportunity for people to fall into marketing claims. All right. And so we need to be reality-based for a number of important reasons. And the second type of question, the second group of people, are those who are really well educated, and they have become self-care clinicians out of necessity, because they're not getting the help that they need from either the allopathic side or the natural medicine side. They have tried both. They are finding some things work, but they're still not getting better. And they're going into the research. They're studying the information in the databases. They're, taking herbal courses. They're doing a lot for themselves. And some of the questions that have come to me are really sophisticated biochemical, complex herbal questions. And that, is really eye-opening to discover that there's this group of people out there who know a whole lot more than practitioners and doctors. So that's the other main influence on this course, is why this is happening. What's the need behind it? What do we do about it? You see. So who's going to get some benefit from this course? That's the next question. And what are some realistic expectations? Well, first of all, everybody can benefit from knowing more about yourself, knowing more about ourselves, and increasing our self-awareness, and to practice higher level self-care. Now, there are some factors that will influence how much benefit people get from this course, or from natural medicine, or from allopathic medicine. So in order to practice a higher level of self-care, or in order to practice self-care at all, I should start with, and then a higher level, and then a clinical level of it, we need certain resources. And this is fundamental to everybody, and it really determines what we can do. We need time. And the more time that we have, the more we can take care of ourselves. And that means study and routines and so forth. And the more chronic and complex the condition is, the more we actually have to invest in time for this. But it's not just time, it's also money. You see, we need some basic financial resources. And I hate to say it, but natural medicine is really a luxury of a certain socioeconomic group of people, because of our political system. It's not being covered. And so we have to pay for it out of pocket. But that's also one of the reasons why it's important to learn how to do this, because the more we do it ourselves, the more cost effective it is ultimately. You see? So really we're investing. Okay, we're investing in education and in treatments and in healthy food and in herbs and so forth. And it is sad that it is limited by these socioeconomic factors. But the necessity of doing it ourselves is increasing. All right. And if we really do it ourselves fully, then the big picture is we actually end up growing our own herbs and preparing our own medicines. And so we invest a lot of time, but we get really high quality medicine and we know what to do with it. And that's really going back to how medicine used to be, you see, that it was much more based on self-care. So it also requires a fair amount of interest and dedication. And you obviously wouldn't be here if you didn't have the interest. And it's going to take dedication for you to do these kinds of processes, okay? And so with that, I would just like to say welcome to a very specialized branch of natural medicine. And the term I am using is, somebody popped this into the chat, the term I am using is allopathic, okay? Allopathic means modern conventional pharmaceutical-based medicine, allopathic. Now, there are some objectives that I would like to accomplish, and I think these will happen. And it's kind of like a journey. So what we're doing is we're starting, and we're starting in several different areas, and we're going to make a transition. And then certainly by the end of this course, you'll have the tools to continue on that journey. And in several different areas, you'll be able to basically reach a higher level of self-care. So first of all, there's a transition that's happening in people's thinking. And at the beginning, we place all the responsibility for our health in the hands of doctors and drugs. That's where a lot of people are starting from. The doctor knows everything. I take the drug, I follow the directions. That's it. The transitional point is that we start to realize, oh, I have responsibility for my health. And that includes what my lifestyle is. And when that phase starts, then immediately the confusion comes, because there's so much information about, well, what do I do? What do I eat? And what products do I take? And how do I do this? So the objective, the goal here is making highly educated decisions based on critical thinking and clear analysis and the questioning process and medical studies and so forth. A lot of people are also starting this journey because of their allopathic experiences. They want to get off the medications, or they're having side effects. They have had a bad experience. The transitional phase is that they're looking for answers on the internet, but maybe their doctor doesn't support them in doing that. So the clinical objective here is to be an educated and empowered patient. And we can all be that. And it doesn't take that much either. And we can be the kind of patient that says, I discuss what I want and how to accomplish it with my doctors, and we find a good meeting of minds. And, you know, I do what is necessary from my side to instill confidence in the doctor so that they don't feel that they have to keep me on these medications. So I find the good doctors to work with, and we find a collaboration. That's the next objective. And then there's more practical things like the diet. People start and they finally realize, oh, maybe my diet has an influence, so maybe I should eat right. And then there's a transitional phase where they're confused and, well, what diet should I use? And then there's the clinical level that we would like to get to, which is you understand your digestive system. You understand why this diet works and that diet does not. And you understand why you feel the way you do when you eat something. And that's a good objective, because at that point, you don't have to talk to other clinicians about it. If you don't know, you just ask your digestive system. And you're going to hear me say things like that over and over during the next 5 weeks, because in a certain way, no matter how much information we get intellectually and academically, ultimately it's your stomach that's going to tell you whether you can use something or not. So that applies with herbs. Same, you know, we start off hearing about it, and we get confused because there's so much out there. And then finally we learn how to use them in a highly individual kind of way. And I'll just say that recently, this particular subject has been clarified very much by this explosion of interest in immune boosting herbs, all right? And this is a perfect example of why we need to have a course like this. So the starting point is suddenly everybody is thinking, I should take some immune boosting herbs to protect myself because of the pandemic. In the transitional phase that follows shortly after that, you don't have to go much further. And suddenly you're looking at this plethora of all of these products, and you don't know which ones. And you go ahead and you buy some, And then you have a home pharmacy that's based on every company telling you that they have the best product, but you don't actually know, are these products good, or do I need them, or what do they actually do? And what does my stomach feel about them? And so the objective then with this process is we want to get to the next level. It's great that people are interested in immune boosting now, and it's great that people are becoming interested in herbal products for that. But I'm sure there's a lot of people that now have a big collection of immune boosting products, and many times the majority of those products they don't need. They're not very good, and they probably might even have some adverse reactions if you take too much. So the clinical level then with this question is, which products are actually good quality, and will any of these act as stimulants, and will they aggravate inflammation, and are they contraindicated for autoimmune conditions, and will they upset your stomach, and do you actually need them, and will they actually boost immunity? That's a fundamental question. Do immune boosting herbs actually boost immunity? Those are a few of the things that we're going to be discussing. And those are a few of the objectives that we have. Okay, so now we can start the details of Module 1, Developing Self-Care Diagnostic Skills. So this is a process, developing self-care diagnostic skills. So what does that mean? Well, it's the ability to diagnose ourselves using a variety of different tools, including self-awareness and internet research and body awareness. And well, that's what this module is about. I'm going to tell you several things that you can do. And so there's many levels of diagnosis that are available. There's allopathic testing, like the blood work that we'll talk about tonight. And there's our health history, because you can actually diagnose a lot just by understanding the progression of the illness. And then there's all kinds of body feedback methods. And then there's things like the Ayurvedic body types, and then there's understanding of long-term consequences of medications. And there's many, many ways that we can understand diagnosis, okay? So the main things that we're going to touch on here tonight, as much as we can get through, and we will get through everything, even if we carry over a little bit into next week. What is clinical level self-care? The importance of having a detailed health history, understanding how past conditions can lead to complex immunological and inflammatory conditions, commonly overlooked causes of unrelated symptoms, apparently unrelated, recognizing how local conditions in one part of the body affect other parts of the body. What do you do when you get conflicting diagnoses, and the resources for ordering and interpreting your own blood tests, and how to use body awareness and Ayurvedic body type analysis. Those are the main things that we're going to cover. So let's just go ahead and jump in now. And I'm going to go ahead and open up the first file for you. And this file is titled, this is the self-care routines file. Okay. And so now what I'm going to do is I'm going to put this up on a screen share, and to juggle around so many screens here. So let me see. Now, where did you all go? All right, here you are. Okay, now screen share. Okay, so now you should be able to see this file titled Self-Care Routines, Clinical Level Self-Care and Self-Care Diagnosis. Sherry, can you just confirm for me that that's on the screen? Or somebody just give me a thumbs up, everything's okay?
Yep, looks good.
All right, great. All right, now these files are posted for you to come back and refer to. And this is a homework assignment also. This is a big homework assignment that's going to take you years. So this basically asks a few fundamental questions. What are your current self-care routines, and what do they accomplish? and what do you know you should be doing but you aren't, and what do you think you should be doing instead. And so this is a starting point for how we take care of ourselves, but it's also a starting point for self-diagnosis. So the healthcare routines are the basis of establishing good conditions for getting well, okay? And these are fundamental preliminary practices, and I've outlined them in different categories. And one is a very important principle that we start with here in self-care is many times you actually don't need treatment. You need preliminary practices, okay? And this is fundamental to Ayurvedic lifestyle counseling, for example, which is that, there's a beautiful Ayurvedic saying, which is if you have a good diet, you don't need doctors or drugs. And if you don't have a good diet, you don't need doctors or drugs. And so what that basically means is that if you have a good diet, then you're going to get well and stay well. And if you don't have a good diet, then there's no point in going to see doctors. So that's true with so many different kinds of things. And so we set up the preliminary practices first. And guess what happens? The preliminary practices in almost all cases improve things dramatically. And in some cases, that's all you needed. All you needed were these preliminary practices. And the preliminary practices are doing the common sense things that we know that we should. So here we will use this just to kind of bring this topic into our awareness, but we are also going to graduate into how do we do this for self-diagnosis, all right? And there's 4 main topics here. The first is called Prajnaparada. This is an Ayurvedic term. And then there's basic self-care practices, and then there's advanced self-care practices, and then there's using it for diagnosis. So the first topic then is called Prajnaparada. And those of you who have been in some of the more advanced courses that I've done, you've heard this term. And there's all kinds of translations of this term, but basically there's a lot of the translations are actually rather moralistic, and I don't like them. So crimes against nature and things like that, sins against nature, transgressions against ourselves. So the translation that I like better is just doing the things we know we shouldn't do, all right? So that's what Prajnaparada means. Prajna means wisdom and intelligence, discriminating wisdom, discriminating intelligence, and Parada means the absence of wisdom. So Prajnaparada means that we're not using our discrimination well. We're not using our critical thinking and our judgment well. Now, these basically fall into 2 larger categories, all right? One is the repression of natural bodily functions, and the other is the improper conjunction of the sense organs with the sense objects. So I'm just giving you the real short version here. And the repression of natural bodily functions can cause serious pathologies. And as a matter of fact, I can say that a huge number of complex chronic autoimmune and inflammatory conditions are based on suppression, and specifically suppression of sleep. I mean, think how many people now are sleep deprived, okay? That's a form of a transgression against ourself, all right? So the first category is the repression of natural bodily functions, and one is suppressing the appetite. This happens when people do excessive detox or excessive fasting, and anorexia, of course, as a psychological disorder. Suppressing thirst, which is a little less common deliberately, but a lot of people are dehydrated. But suppressing sleep is really big, and there's actually a medical condition, a cause of mortality in Asia. People in the corporate world work themselves to death. Literally, they die from sleep deprivation. And this happens from work pressure, family demands, stimulant abuse. And then there's also suppressing emotions. All right, this is important. So these are just a few ideas for you. We're not going to spend a lot of time on this, but then there's the improper conjunction between the sense organs and the sense objects. And I gave here only a few examples that are very common, like the eyes and the ears, and the tongue. So excess, we have a pandemic of excess conjunction between the eyes and misinformation in social media now, and it's confusing people's brains. So too much computer time is hard on the eyes, but I will mention, that working on Zoom is probably the least dangerous occupation in the world, even though it's not good for our eyes. But the deficient side, where we're not connected enough, is that we don't get enough natural light a lot of times. We don't spend enough time in nature. Where we see this really applicable in a lot of cases is the tongue, okay? Excess conjunction with sugar, with alcohol, with smoking, with these kind of things. So this is where we start. We just ask a basic question. Are there things that we can remove to improve the likelihood of making a recovery? And, this is a conversation that I have had thousands of times with people. It's like, take care of first things first. And a lot of times, if you take care of the first thing first, then you won't have to even get further treatment, that's all that you needed to do. So we start with this. And of course, many times in a clinical setting, this will be the determining factor if a person wants to take responsibility or not. All right. And so I have had very simple conversations with people. One young man came in and he was addicted to diet sodas, drank quarts of it literally every day. And in his 20s, his bones and joints were dissolving. And I said, look, here's the answer. You got to stop. And he had been drinking diet sodas since he was a child, and they're highly, highly addictive. And he just said, well, no, I'm not going to stop. I said, okay, that's fine. So another woman came in with the same problem, and I explained it to her, and she was shocked. Oh my God, those diet sodas. I know that there's a problem. I have to have six of them every day. I actually wake up at night and I have to have some. She knew there was a problem. And she said, okay, I'm going to really tough it out. And that withdrawal process for her, that was serious. Okay. So that's where you see whether a person is really a candidate for self-care or not, and natural medicine also, because one of the fundamental things about people, taking medications is that they're not willing to even try a lot of times doing natural things. Now, with these things that we're talking about in this first category, there's two main categories. There's those things that we can do something about, and then there's those things that we can't do anything about. And I always acknowledge this, because when we're talking about self-care and self-care routines and natural medicine, we have to keep in mind that conditions all over the world for, countless people, they don't allow for taking care of themselves. That work is brutal, family life is brutal, society, the conditions of where they live in the environment are brutal. And so I always frame it in terms of, if we have the opportunities to do these things for ourselves, we are blessed, we are fortunate that we can actually practice self-care, all right? Because there are so many things that people cannot change. The opportunities are not there, the resources are not there, and so on. But at the same time, I'm not saying that we all have to be saints here, because there's two different polarities with this. One is, I gave you that Ayurvedic saying already about, well, if you can't eat a good diet, well, don't bother going to doctors, because you need the good diet first, okay? But on the other hand, what that tells us is, all right, the good diet is fundamental, but that applies to all the self-care routines. They're fundamental. But on the other hand, there's a beautiful saying from Hippocrates that I like to share with people, and that is that it's better to have a small amount of something that isn't good for you if you really enjoy it, than a large amount of something that is good for you if you don't enjoy it. You see, so pleasure and enjoyment is also a big factor in how we live our lives. And especially as we get older and at a certain point in life, it's like all these disciplines, Well, they're not so important, you know. And if we get older, it's probably because we've done something right. Okay. So like Groucho Marx said on his 80th birthday, if I had known I was going to live this long, I would have taken better care of myself. All right, now we go to basic self-care practices. And basic self-care practices are, and this is your homework assignment here, part 2. Part 1 is just for your own consideration. Are there things that you could just remove? I will mention, by the way, that when it comes to removing things that are causing problems for us, that's an individual choice, and that I have a few points that I always give to people about this. One is when people come in and they want to get better, I just say, look, you're fighting an enemy, okay? And it's a battle, and the enemy is inflammation, or the enemy is acidity, or the enemy are these microbes or whatever. And I'm going to tell them, look, that alcohol feeds your enemy, okay? The sugar is feeding your enemy. And I know you love alcohol and you love sugar, and it's your choice. Do you want to feed your enemy, or do you want to starve your enemy? All right. So that's how we have to look at the disease process, is something inside of us that we have to subdue. And one of the easiest ways is that we have to feed the body and starve the enemy, starve the disease process. And when we look at it that way, we have a very clear choice. How dedicated are we? You know, and I have been faced with some serious health challenges in my life. And I will tell you that during those periods of time that I came to the understanding that I would do anything for any length of time to get well. And I did. And so that's why I think it's really important that we understand our willpower here. Okay, so basic self-care routines. These are all fundamental, but they have a huge impact on our health. And a lot of times we can find the reason why we're not well in these things. Our diet and our sleep and exercise and mental habits and emotional habits and self-nourishing routines, natural medicine treatments, supplements and herbs, spiritual practices. One thing a lot of people overlook is their posture. Okay, posture has a pretty big impact. So I'm just going to invite you to look at the impact of all of these kinds of things diagnostically, okay? And how could they be improved? Mental and emotional habits, I want to give you a little comment here. I have come gradually to appreciate that mental habits and emotional habits are actually like being in a certain kind of internal environment, all right? And so a term that comes to my mind frequently is bardo, all right? And you may know that term. It's a transitional state that we pass through. So there's a bardo of life, there's a bardo of death, there's a bardo of rebirth, there's a bardo of meditation, there's a bardo of sleep and dreams. We're passing through transitional states. And what I've come to realize, and I'll just, I'll just share from my own personal experience, is it seems that in my day, I passed through some fairly routine, mundane bardos over and over again. And they're kind of like, here's a set of worry and concerns. Here's a little relaxation and decompression time, okay? And now here's another bardo over here where I'm thinking about this again. And oh, and here's this emotional bardo over here. It's like after a while, the internal environment becomes very predictable because we're just going around and around in the same kinds of things. Those things imprint the body, and they're very important to understand. And at the same time, the body is also creating those, and that's even more important to understand. You wake up and you have terrible anxiety in the morning. Well, there's probably something going on in your digestive tract, in your blood sugar, okay? And so a lot of these things we can learn not to take them seriously. We just need to get up and do some self-care routines, and then we're going to get out of those mental and emotional bardos. So the next phase, advanced self-care practices. And these are things that if we actually start doing these, we're going to really start to revitalize and rejuvenate ourselves. A lot of these things are found in yoga and qigong, and Ayurvedic therapies, and a lot of the therapies that, you know, we used to pay people to do when we could see people, we can do them ourselves. So yogic breathing, pranayama. I don't get real fancy with this. I just encourage everybody to breathe more deeply and more slowly, more consciously, more often. And it makes a huge impact. Yoga Nidra, the yogic sleep. Abdominal massage. How many people do abdominal massage on a regular basis? You can take care of a huge number of digestive problems that way. Kegels, all right? It's a funny sounding thing, but it's an incredible internal exercise, okay, for the pelvic floor. Nauli is an abdominal exercise. Eye compresses, eye exercises, abhyanga, oleation of the whole body or parts of the body. Nasya, the oil applications, medicated oil for the nose, oral hygiene, and then generating saliva. This is something that's a revelation for a lot of people, that they don't have enough saliva, especially if they're on medications. And that's the cause of their digestive problems. And if you can just sit down and consciously generate saliva several times a day, you're going to increase your digestive power. And then hydrotherapy of all these different types. And then here's your first internet resource, nauli.org. And you're going to see all kinds of skinny people rolling their abdominal muscles. So it's hard for people who have some excess belly fat to start with this, but if you can actually start doing this, it will have an incredible effect on your abdominal health. So these are advanced practices, and the more we can bring these in, this is also a limited list here. And I invite you, if you have other things that you would like to share with your fellow students that you do that have helped you, this is also one of the functions of this class. You can put it in the chat. Now, diagnosing using the self-care routines or self-care practices. So your assignment here is practice both the basic and advanced self-care methods consistently and gradually increase the awareness and mindfulness of their effects as they begin to produce their benefits. So like body feedback about the diet, here's a whole long list of things. And it's amazing if you go system by system, organ by organ, sense organ by sense organ, how many things we don't pay attention to. And the more we start to really pay attention to the systems and the organs, the more we can start to see that there's all of these practices that are just hiding inside the body, actually. So how well do you chew your food? And you could ask the question, well, do you think it makes a difference? And that's closely related to how's the health of your saliva. And that's totally related to the functioning of your digestive system. And I've seen countless people improve their digestive function, not by taking more antacids, but by just generating more saliva. So we're trying to get our body to do the work, okay? So what's the optimum amount of food to eat? And how do you know? What's the signal? When to stop? And what's the difference between eating when you're stressed and when you're relaxed? And how many times do you eat when you're actually not really hungry? Or how often do you eat when you are past your point of hunger and your system is too acidic? And what are you going to do about it then? And then, does the food actually give you feelings of satiation? And can you smell your food? And what is the effect of that? And how do you know if you're drinking too much fluid? And especially, how do you know if you're getting enough fluid if you're not actually thirsty much? Okay, this is a common kind of thing. What's happening with the production of saliva? And did you know that around 3 in the morning that your brain sends a signal to the GI tract to start a wave of peristalsis to clean toxins out? Are you aware of that and what it means and how to work with it and take advantage of it? And what happens in the relationship between the food that you eat in the evening and how you sleep and how you feel the next morning? Now, we all have a basic sense of what these things are, but I imagine that the majority of us have not actually turned these into specific studies for ourselves, okay, to really take it apart and find these things out. And that's how we get to clinical level self-care. So with the diet and the foods, all right, the most basic principle here is set a baseline diet, because you can't experiment if your diet's all over the place and if you don't eat regularly. So same time every day, breakfast, lunch, and dinner, and pretty narrow diet. Okay. And so what I generally recommend, warm food, easy to digest food. And I'll give you some further details about it, but think baby food diet, okay, for starting to kind of get your digestive system organized and to do experimentation. Simplicity allows us to do experimentation and see cause and effect more clearly, all right? And we can also use the Ayurvedic body type analysis that we'll get to in a little bit. Sleep, what are the effects of meditation, yoga nidra on your sleep cycles? What's the effect of artificial light or natural light? Moonlight, starlight. What's the effect of the food that you had for dinner? Breathing, how much are you breathing mindfully? And what happens if you do it extended several times during the day? What happens what's the difference between slow, deep breathing and rapid pranayama? Okay. How does that affect your digestion? Exercise, experiment mindfully with different kinds of exercise, different durations, all these kind of things. Posture, check your posture. That's your homework assignment. Now, let me go ahead and switch back over here because I wanted to talk a little bit more about how to do these advanced practices. Okay. And well, actually, let me put this back. No, it's all right. You already, you saw it. Okay. So now you have these advanced practices, and you saw category, the third category of advanced practices, the basic practices, and then a long list of what you do with it. So when we are using this for self-diagnosis, okay, we're using these self-care routines for self-diagnosis. There's a couple of questions. The first is, well, how do we use these self-care routines for diagnosis? And the opposite, how do we use a diagnosis to guide our self-care? All right. And there's two standard answers and two surprising answers. Okay. The two standard answers of how we use these for diagnosis and for self-care is, number one, academic study and research. And that's what we're going to be doing specifically in the next module, is how do we actually study databases and get good resources and so forth. It helps to know our Ayurvedic body type. That's a good basic system, and blood work can help us. And then there's the internal subjective side of things. And the more we bring our attention to the body, the more successful we will be in understanding how to use these things, both diagnostically and therapeutically. All right. And I will also mention that people who practice contemplative practices, self-inquiry, body awareness, they have higher physiological reactions and capacity to heal themselves using natural medicine than people who are not really living in their body. All right. There's actually, and I've seen this over and over for decades, there is actually a kind of healing power that just comes from paying attention to the body. And the more deeply we do it, the more responsive the body becomes. So now there's a couple of surprising answers to that question. And those are, how do we use self-care to diagnose, and how do we use diagnosis for our self-care? But here's a surprising answer. And I didn't catch this until just a few days ago, actually. There's a contradiction in the term clinical level self-care. Did you catch it? And that is that most clinicians don't take care of themselves. And so it's amazing to me, and I've worked in a lot of medical situations and met a lot of healthcare practitioners, and it's actually a cause of gratitude and compassion if you think about it, because working in the medical industry is brutal, and especially now in the pandemic. I mean, this is heroic work. But if you go anywhere to any kind of clinic, the likelihood of people being there who are drinking diet sodas is pretty high. And so it's part of the mindset actually around modern allopathic medicine is that it doesn't appear that it's, a real health conscious crowd, right? You're going to find a health conscious crowd going to yoga classes and Ayurvedic retreats instead. So what we're really talking about then is not clinical level self-care in a certain way. What we're talking about is yogic level self-care, Qigong level self-care, health food chef level self-care, and psychotherapist level, because we should also understand ourselves and take care of ourselves mentally and emotionally, and Ayurvedic therapist level and the level of an athlete, okay? So that's really what we're talking about here as opposed to clinical. But clinical level self-care actually means that we are really taking this to a much higher level. And I just want to mention another thing here is that a lot of times we don't actually have to have a diagnosis to get better. And I've seen this over and over again, that people, they go from doctor to doctor, they're not getting the results. They don't even understand what's going on. You do the preliminary practices, and especially if they escalate them to the higher levels, they get well, and they never even knew what they had. So that's an important principle here with clinical level. So what we're really talking about is that healing is fundamentally a process of changing our physiology. And there's times when we need allopathic intervention, and there's times we need some targeted clinical level of natural medicine. Sometimes we need both. But what it really comes down to a lot is how much can we change our physiology? And I can tell you, we can change it dramatically. But what are the resources? Goes back to that. And do we have access to people who can help us, and the clinics and the spas? And are we willing to go on a month-long backpacking trip? I mean, I've heard some amazing kinds of things about people who are really badly out of shape, metabolic syndrome and overweight and blood sugar's high and cholesterol's high and all these things. And they put on a backpack and they walk out into nature, and they come back a month or two later and like all that stuff's gone. All right. So we also have to remember that a lot of what we're fighting when we're trying to change our body is we're fighting the conditions of modern life that we are immersed in all the time, okay? And if we were to actually go back to a more primitive kind of lifestyle, we wouldn't be overweight at all, okay? We wouldn't have metabolic syndrome. So are we willing to do the intensive dietary change and the detox if needed? And are we willing to listen to physiology as opposed to ideology? All right, that's a question that I ask people a lot, because many people, their self-care routines are based on ideology and they're not listening to their physiology. So self-care diagnosis is really just learning to monitor those things that we just looked at on the file and adjust them. Don't do those things extremely, okay? Don't do them deficiently either. And that just means, check in. Does the food agree with you or doesn't it? Are you getting enough or not enough sleep, and managing your stress and all these kind of things. So this is all common sense. And so now we've used up half the class and we've covered one point. And that's kind of typical in how my classes go. But now I'm going to jump ahead here and go to the next point here. Now we get to your next homework assignment, and that is the importance of a detailed health history. All right. And I'll introduce it, then I'll pull it up on the screen. Now, one of the most basic challenges that we will have in this course is actually translating the diagnostic information that we gather into an herbal practice, okay? But the more we know about our health history, the more it allows us to start focusing the herb program more. So a health history is health intake form at a doctor's office. It's just a normal part of medical practice. But I have found that those types of forms that they give you, they don't really do the detective work. They don't connect the dots. And what we're really trying to do here is connect the dots. And I've got several files to show you of how important it is to understand this happened 10 years ago, and then 2 years later, that happened. And then a year later, this happened. And a lot of times people don't connect the dots between starting a medication and the side effects, or a surgery, and then a few years later, the scar tissue and all these kind of things. And so this will be your next homework assignment, is do this, but do it in a particular way that I'll show you here. And it's a very important method. It's a system of gathering self-knowledge and self-awareness. And it explains a lot about how illness develops over time, and it can help us with our treatment priorities. And clinicians of all types frequently overlook really important connections and events. And many times patients forget about things as well. And so if you go back, I've heard many, many times, oh my God, I remembered, 20 years ago, I actually had the bullseye rash from a tick bite, and I never connected it to the symptoms that happened afterwards, and I never got checked for Lyme, and I've had all these things for 20 years now. Okay, these are the kinds of stories that I hear, and it's no fault of anybody. It's just that, 20 years ago, Lyme wasn't on people's horizon, that's all. So we overlook things, we forget things, and it's good to do it to put it, bring it back into perspective here. And especially when it comes to medications, it's crucial. And I'll give you an example. I'll show you a chart that's based on what happens after antibiotics, okay? So we try to connect the different systems in the body. And I'm gonna go ahead and jump over now to that file so that you can follow along. And that one is called Creating a Health History. And I'll put this on the screen share. All right. Okay, so that should be good. So part one, general, all right? And this is a simple assignment. The more in-depth you do this, the more helpful it will be. Now, the main thing that we're doing here that's a bit different than an intake form is we're doing a chronological history, all right? It starts with your mother's health. You can also include family health in there as well, but it includes things like, did your mother smoke? I mean, that's a big constitutional influence. And did you have birth trauma? Medical birth trauma. Birth is traumatic, but did you have something that was medical? Were you a preemie? That's going to influence your constitution, and throughout life, that's going to have an impact on your immune system. And a lot of people don't connect those dots, and those are fundamental, okay? So create a file that contains as much health history as you can remember and put it in chronological order. And you may already know a particular diagnosis that's happening right now, but this is to help you see a progression of events. Family history, that means genetic predispositions. And this can help you a lot to prioritize preventive medicine, all right? And if you know, for example, that one or both of your parents had colon cancer, well, that means you better be really conscious of your diet, okay? And then we come to major illnesses, acute and chronic, the onset, the development, duration, the treatment, the sequela. That's the long-term effect of a temporary condition. Right? Medications, when you started the medications and why and how long, and the side effects that you noticed. And we're going to be talking about this in quite a bit of detail in Module 3 about the interface between the two medical systems. But lots and lots of times in discussions with people, I'm asking a basic question. When did you start the medication and when did the symptoms start? All right. And you think, well, wait a minute, I took the medication for some symptoms. but then some new symptoms came. And the allopathic system is very much based on, layering the medications. And now you got something. And so now take this. And now it's causing that. So take this. It's very well known. This is not a question of debate. But how about vaccines? This is a big question of debate. But I'm going to give you some short answers how we cut through the debate, okay? Because there's important information we should know, and then there's the debate. And we don't have to get too caught up in it. But this is really important if there are things that you can trace back to adverse reactions, and they do happen. And this is something to be aware of as an adult if you have had multiple vaccinations for different professional reasons, okay? Military people, medical professionals have to do it. In a lot of international travel requires sometimes certain professions. So I'll give you an overview, but without getting into the debate, just put your history there. And especially if you've had some incidents that you know about. Onset of symptoms connected to environmental toxins. This is really overlooked in allopathic medicine, in modern medicine. Mold in the home and smoke in the environment. And we know that, our country here in the US is half of it's underwater and the other half's on fire. And those things are really having a big impact on people's health and not being recognized to the true degree of the seriousness, okay? So agriculture and industry, I talk to people all the time who trace back their cancer to being around high chronic levels of pesticides or working in a toxic industry. And career, things that are in a toxic office building, or people who work in certain fields where they might be handling a lot of solvents and chemicals and exposure to radiation, things like that. Travel history, and this is especially important if you had a digestive illness while you were traveling. If you had a digestive infection while you were traveling, that justifies more in-depth research through testing to find out if something is still there or not. Surgeries can have long-term effects. Dental, a big thing that people overlook. And I'm going to mention a few things here, like the implanted materials, the mercury, the root canals, the low-grade infections, the effect that this has on the head, all right? So make sure and think about this. This is overlooked a lot, both in allopathic and naturopathic medicine. Allergies. What was the sensitization incident? Did you come that way? Or did you have a big mold exposure at age 30 that triggered things suddenly? And did you go through having all of those injections, 60 different things injected in the back of your skin, back in the skin in your back, and multiple times? And what was the effect on your immune system of doing that? See, these are questions we have to ask also. Pregnancies, healthy, abortions, miscarriages, C-sections. And then part 2, you can also go through and you can list this by system, digestive system, respiratory, and so forth. All right, so that's the other part of your homework assignment. And this will give you even more insight into who you are and how to start connecting some dots. And so now another file that I want to show you is commonly overlooked causes of apparently unrelated symptoms. Now this is self-care diagnosis, is when we start to connect some dots and say, oh, wait a minute, there's a relationship between the teeth and the sinuses? Oh, okay. So let's look at this. Where did it go? Okay, here we go. And now let me pull you all back up again and share this. All right, here we go. Recognizing how localized conditions can affect other parts of the body. This is just the first introduction to this because we're going to be studying this a lot when we come to the more complex conditions in Module 5, some of the issues with herb-drug interactions in Module 4, and some of the issues about using herbs or some of the things that happen with side effects of drugs in Module 3, all right? So you now have another addition to doing your health history, and that's this. Include in the health history known connections, things that you can remember, and this will at least get you thinking, okay? You may have thought of it or known it before. This may actually help you to really remember something and to connect some dots. And this is clinical level thinking, all right? And unfortunately, a lot of times we are not thinking holistically in medical practice. The more specialized something becomes in allopathic medicine, the less they tend to see the relationships with the rest of the body, okay? To the point where a GI doctor may not even tell you to have a healthy diet. I mean, you know, it's too specialized for its own good in some ways. On the other hand, it's also happening with natural medicine as well. But here's the reference for this. The reference for this is classical Asian medicine, you see. Chinese medicine and Ayurvedic medicine, Tibetan medicine, all those systems of medicine, they were all based on treating interrelated systems. And that was the diagnosis. What are these interrelated systems presenting? So therefore, if you had a diagnosis of stagnant liver qi, okay, they weren't looking at the microscopic components of your liver. They were looking at, oh, you have musculoskeletal tension in your neck and you feel irritable and you have gas and bloating. And it's a whole presentation of interrelated symptoms. And the thing is that's how the body works, okay? Everything is always affecting everything else. And the more we understand these interrelationships, the more we know who we are, the more we understand why we feel what we do, and the more we can do something about it. So this is just the first step in increasing our awareness. Now, the nice thing is that a lot of this information is available in classical Ayurveda, and it's the main thing you're going to see when you do the Ayurvedic body type quiz, which will be part of your assignment for today. And you're going to see, oh, a Vata person has all of these things that are happening in different ways in different parts of the body, and that's a system, okay? And that means you automatically have a bunch of foods that are good for you and not good for you, and herbs that are good for you and not good for you. And so it's a good model, but that's there in Chinese medicine, and we can learn the basics. And the nice thing about this information is that now, finally, modern medicine is recognizing these interconnections, and a lot of it is coming from the naturopathic profession. So terms like gut-brain axis, all right, that's a very common term now in popular internet medicine. Naturopathic medicine came up with it, as far as I know. But all they're talking about is they're basically talking about spleen qi in Chinese medicine and the effect of eating too much gluten on your fluid stagnation that affects your brain. So these relationships are starting to come, and it does not take a high level of medical training to recognize something and at least start paying attention to it. So for example, when you do your health history, did you find that you had certain dental work done and then you had sinus problems? Did you start getting sinus infections after that root canal in the upper jaw, okay? Dental and headaches, that's very common. How about dental and digestive, all right? There's a strong link between both systems both ways, all right? So digestive problems in the lower are going to affect your oral health and vice versa. And then the GI tract is connected to everything: gut brain, gut lung, gut musculoskeletal, gut skin, gut cardiovascular. See if you can find for yourself. You eat certain foods, it increases the pain in your joints, okay? That's what we want to start looking for, is these kind of connections. And then musculoskeletal, well, what about posture and the breathing and sleep and all these kind of things? And then adrenal, Here's some good axes, okay? The adrenal pancreas axis, adrenal musculoskeletal. Well, what is adrenal pancreas? That means you had too many shots of espresso, and then your blood sugar went all out of balance. And you do that every day, right? And you wonder why you don't feel good. And then what about adrenal musculoskeletal? Well, that's a real common thing. We get under stress, our musculoskeletal system gets tight, and we worsen our symptoms there. Adrenal stress affects the digestive system. So these are a few things to think about. And let me see if I have any other specific things I wanted to say about that. Okay. All right, so I'm going to pull up another one now. And this one is titled, what is it titled? It's called Causes of Autoimmune Conditions. All right. Now, the reason that I want to show you this file titled Causes of Autoimmune Conditions is because there is a main topic that we're now going to talk about, which is understanding how past conditions can lead to complex immunological and inflammatory conditions. Now, complex immunological inflammatory conditions, the two best examples of this are autoimmune conditions and cancers, all right? Because they both involve deep inflammatory processes and they are both immunological disorders, all right? Autoimmune disorders are hyperfunctioning, where the body's attacking itself, and cancers are hypofunctioning. The immune system isn't able to attack it. Cancer cells are under the radar. Now, the reason that I'm giving you this is because when you do your health history exercise, you will find that you have numerous contributing factors already happening to both of these conditions. So what does that mean? That means if you have an autoimmune condition, it will help you understand how you got it. But even more importantly, it will help us prevent it, okay? So it gives us diagnostic information, and it also it gives us health history diagnostic information, connecting some dots, and it gives us some preventive treatment strategies. And it also tells us a lot about what systems are affected and why and how. So this can help us to prioritize our treatments. I'll just go ahead and pull this up now. Let's see, where did you all go? Here you are, okay. All right, here it is. Now, I want to mention here that this is a compilation from multiple sources, and the information is primarily from multiple sources in the naturopathic community, but many of these are also recognized in conventional medicine as well. All right, so from this information, we're going to learn a lot, how to prioritize our treatments, how to remove these causes so that they don't affect us if we can. A very big issue in treating complex conditions is, what do you treat first? Because there's so many things going on. And so this is an exercise in kind of organizing a strategy. So here are the main things, okay? There are genetic factors, there's ethnicity, there's age, there's stress and exhaustion, trauma and shock, sleep disturbances, psychological factors, lifestyle, viral infections, intestinal parasites, yeast, bacterial infections, chemical toxins of all different types, prescription drugs, implantation of foreign material, which triggers the immune system, such as, dental materials, surgical implants, vaccines, leaky gut syndrome, food allergies, sensitivities, nutritional deficiencies, pre-existing chronic illness, and hormonal imbalance. Now, that's not the full list. These are just some of the most basic important things. And of course, what we look for is how many of these does it take? Well, if you have a genetic predisposition, excuse me, for a type of autoimmune condition, then you should be even more careful with your health, obviously. And the more of these factors that you have, the more you should work on removing them. Now, frequently what happens is that there's a lot of buildup where people have things that are happening and they're sort of causing subclinical low-grade symptoms, and people they're not feeling really good, but they're not really sick either. And then suddenly the key thing that triggers this is prolonged stress, all right? And lack of sleep. Prolonged stress and lack of sleep will activate all of these other factors that are like seeds that have been planted in the body. So we all have these seeds of disease that are in us, but what's going to actually cause them to sprout and grow? Frequently, it's the stress and insomnia that does it, okay? So that's something for you to consider, and you can put that into your health history also. And that's also to help you understand why health history is really important, you see. So I think you can probably see at this point that already, if you do these exercises, you've done far more than just filling out an intake form in a doctor's office. All right? You're really going to know quite a lot more about what's going on. Now, the next one is a little bit controversial, and that's okay. And it's controversial because I'm going to talk about vaccines. Now, I just want to say a few words about vaccines before we move into this. They are part of health history for almost everybody. And as you can see, they're also a well-known contributing factor for chronic illness that is established and widely believed, okay, in the naturopathic community. And I've seen this also. Now, I am only going to address the medical aspect of vaccines, which is relatively simple, okay? I'm not going to talk about the political side of it, and I'm not going to talk about the sociological side, because the political and the sociological sides of vaccine is very, very messy and complicated and polarized. And when things are polarized, it generally means that both sides are wrong and they're not understanding the subtleties. So the medical aspect is pretty simple here. Vaccines are like all pharmaceutical drugs. They have benefits and they have risks, okay? Now, if you are skeptical of me saying they have benefits, then I would just say, talk to somebody who's had polio, okay? And I have. And it's not very common anymore. It is because of vaccines. Or talk to somebody, you know, who had something that we don't even think of anymore, okay? Now, that's the benefit. But the reason the political and the sociological is so messy is because of all the adverse reactions and risks, all right? So all drugs, including vaccines, have a risk and benefit ratio. That's all there is to it. And what we have to do is we have to look at the risk and benefit ratio, and we have to decide whether the benefits outweigh the risks, whether it's a prescription drug or it's a vaccine. That's all there is. And the risk factors are not cookie cutter topics either. The risk factors have a lot to do with whether you are a Vata, Pitta, or Kapha constitution in Ayurveda. It has a lot to do with your immunological health and your age and underlying conditions. So it is not politically or sociologically or even medically correct to say that, oh, vaccines are across the board good for everybody. They're going to, you know, give us some, you know, collective immunity against the pandemic. Well, if the vaccine is developed successfully, and that's a big question, and if people actually are willing to take it, which is another big question, then what will be found is the same thing as all vaccines, which is that there will be certain benefits and then there will be people that will be harmed by it. And it's just the same as, you know, taking proton pump inhibitors for your GERD. It's no different. So I want to give you a website here before I go any further. I'm going to put this in the chat. And this is really simple. It is, okay, let me make sure that I put this to everybody and to everyone. I don't actually need to put it in here because it's so simple. It's drugs.com. Okay, so I'm going to be sharing with you resources that I use, and I use drugs.com along with a number of other websites that you probably know about, like WebMD and things like that. But I'm going to put another one here now, and this is about the MMR, okay, vaccine. And this is the measles, mumps, rubella vaccine. And this has been a very highly controversial vaccine. But not now, but after class, just go ahead and, you know, take this information down, because this will disappear when we close the chat. But I just want to tell you that we don't have to debate anything. All we have to do is we just have to read the insert that comes with it. And it says right there in the insert of the vaccine, there's all these benefits and there's all these risks, and that's all. So one of the first things that I always find amazing with these inserts with vaccines is it says the vaccine may not provide protection from disease in every person. And this was something that I actually saw. I learned this firsthand treating people in Kathmandu back in the 80s. I saw that people who had received a typhoid vaccination still came down with typhoid. So there's a question for you. All right, so now let's look at the next file. And the next file is titled Common Patterns of Iatrogenic Illness Associated with Antibiotic Use. That's a mouthful. Well, what is iatrogenic? Iatrogenic means caused by doctors and drugs, all right? And this is something, I'll just mention, this is something I wrote almost 30 years ago, okay, in my clinical practice. And I just took notes and I put it down and I organized it because that's what I was seeing. And now this is coming out more and more in the naturopathic community. So this is something for you to think about when you do your health history, because if these things are in your health history, this explains a lot about how we got to where we are, what we're susceptible to, how things developed, and what to do about them. Now, you'll see here that vaccines are involved because I was seeing so much connection. And that's why I gave you the overview of what's my position about vaccines. This is just an observation. I observed, and naturopathic practitioners are now observing this more and more, that childhood vaccines can have the adverse reaction of leading to neuroinflammation and immune sensitization. And that's what, neuroinflammation is at the root of cognitive disorders like ADHD and autism. And of course, the big political thing is no link, all right? But there's too many unsolved questions to just say there's no link. Because if you look at the insert that comes with the vaccine, there is a link and it says that there is a risk of neuroinflammatory conditions, okay? So then after that, the onset of allergic constitution, that means that vaccines do have the power to actually change the fundamental constitutional immunological health. And from that frequently come food and environmental sensitivities in children, and that can lead to upper respiratory and ear infections with antibiotics. And the more antibiotics, the worse the allergic constitution becomes, okay? So that's a chain of events. And guess what? These are things that I was seeing in patients who were 30 and 40 years old that were still dealing with that allergic constitution. But it goes on because it can further progress into asthma and steroid dependency. Repeated antibiotics can lead to worsening allergic sensitivities in the respiratory system, and that can lead to asthma. And then the steroid inhalers come. And then if the kids are on steroid inhalers, they're developing hyperactivity and overstimulated adrenal systems. And then you know where it goes from there. It goes to the Ritalin. So Again, another cycle here, chronic fatigue syndrome and viral infections. So vaccinations, immunological sensitization, repeated colds and flus, repeated antibiotics, and then what's called hiding fevers in Tibetan medicine. That means that the infections are never really cleared out of the body because the immune system's never really burned them off. And this causes a kind of chronic lymphatic stagnation. And that is also frequently found when there are infections like mono and, Epstein-Barr, which are basically the same, and herpes. And so then you get this constitution where you have a viral load on top of all of that. And then that can lead to chronic fatigue syndrome. Then there's the whole thing that happens with sugar addiction and candida and the mercury in the mouth, because the sugars in childhood basically create excess phlegm, which gives opportunistic infections, which leads to antibiotics, which causes candida. And the candida craves the sugar. You see, it's not you craving the sugar, it's the candida that wants the sugar. And then the antibiotics are basically worsening the condition in the mouth, the microbiome of the mouth, and that's leading to bone loss, you see. And so that's why kids get the cavities. It's not necessarily the sugar by itself. It's actually the complete effect in the microbiome of the mouth. And then the dental cavities, and then comes the mercury. Or now what they do is they coat all the teeth proactively with plastic. You can think about the effect of that. And then there's a relationship between mercury and the pathogenic bacteria and yeast in your gut. And guess what? The pathogenic bacteria and yeast in your gut love mercury, okay? And so it goes around and around, and it just gets more developed. And then, by the time you hit your mid-30s, you're not feeling that great and you're looking for some help. And that's about when they came to see me. So menstrual cycles and hormonal disorders, antibiotics basically damages the bacterial ecology of the gut and changes the hormone precursor production in the bacteria, which can lead to liver toxicity, hormone disturbances, early onset of puberty, menstrual irregularities, which are then controlled by birth control pills, which then have further effects. All right, so I think you're seeing the point that I'm trying to make here, is that one thing leads to another. And the more we understand that, the more we're going to understand how we can take care of ourselves. Now let's switch over here. I want to talk a little bit about blood tests, all right? Because now we can do a couple more things before we wrap it up. One is allopathic diagnostic tools that are available to us, and we can talk a little bit about the Ayurvedic body types, but we're almost out of time. It doesn't look like there's been a ton of questions that have come in. Well, actually, before I say that, let me check on this. It looks like, I see, okay. Looks like several questions have come in. So I'm going to leave time for the Q&A. And I'm going to open another file. And this one is going to be about the blood tests that are available. Basic lab testing is what this is called. And I will give you some commentary about basic lab testing. So basic lab testing is accessible to all of us. And it does not require, actually, that we go to the doctor's office. It does require that we go to a local office for getting a local lab to get our blood drawn, okay? Now, there are benefits and there are limitations. And I just want to put this in the right context. Basic lab work is a helpful tool, and that's all. It's just, it is helpful in certain cases because it can show us things that we need to be aware of and work on. It is frequently not that helpful. And I'll just say that the reason I'm only saying basic here is because these are the fundamental things. And there are literally thousands of tests that are available. And I would say at this point, my perspective on this is that a lot of them are questionable. A lot of them are not necessary. A lot of them are not even that accurate. And I receive tests from people all the time in my consulting practice. And I see that frequently they're being misdiagnosed, actually. Okay, and I'll give you an example when I finish with this, but one of the main things that you can do with this information is that you can order the basics. If you have not done it, all right, and this might be something new, a new piece of information for you. If you have not done the basics, I suggest you do it for a couple of reasons. One is that it's a good tool to learn about. And if there is anything that's significantly off, then it will tell you. And if there's something that's more of a sort of borderline, it'll give you information. Oh, well, that's something to work on. And another important reason to do it, if you have not, is to get a baseline. Okay, because hopefully you're going to be around for a long time. And you may want to check back on this 2 years from now, 5 years from now, 20 years from now. You may want to look back and say, well, what was happening back then compared to what's happening now? So what I have done, I have been testing about once a year, 5 times, maybe over the last 7 years or so. Okay, so annually. And what I have seen is helpful correlations between some things that were definitely diagnostic and some things that I was experiencing in my body. And they help me understand, okay, this is a dimension that I need to get under control. They also help me to see the big picture constitutionally of where I need to go. Okay, so really the most important thing about using blood work this way is long-term prevention and management. Okay, now I'm just going to put this up quickly because we're almost totally out of time here. And it is there for you to look at. But this is what you want. This is the basic thing you want. And you don't have to worry about this because there's a couple links at the bottom that'll take you right to this. And this is all you have to do. It's really simple. The complete blood count, it just means they're looking at white blood cells. They differentiate the different white blood cells. They look at the hemoglobin. Okay. And there's a few things listed here: high, low, what does it mean? Blood chemistries. Okay. Sometimes these are helpful, but a lot of times they're just used to confirm, oh yeah, you've got kidney disease. You already knew that anyway, but here it is. You've got high creatinine levels, all right? But another thing is that sometimes you can find some surprising things that were going on that you didn't know about, okay? And that is a good red flag to catch it now before it goes even further. So glucose metabolism, really important here. Everybody should know where their glucose metabolism's at, all right? All the things that have to do with metabolic syndrome, you know, the 3 highs, all right? High cholesterol, high blood pressure, and high blood sugar. These all need to be really brought into focus more. Minerals, thyroid function, very important for some people, good to check in occasionally for everybody else. The lipid panel, the autoimmune testing, and vitamin D, vitamin B12, ferritin. These are standard things. Urinalysis, if there's something specific going on in the urinary system, is going to show you the pH and if there's urinary tract infection or kidney disease, liver problems. And so here are the places, the place and the 2 main labs that I send people to the most. There's a number of other places, but I tell people go to the Life Extension. And here are the main things, the female panel blood test and the male panel blood test, and that covers all these things. Now, the advantage of working with Life Extension is that you also get a free consultation, and that's with a medical doctor. So this is a good resource to know about. Okay, now, finally, your homework assignment before we switch over. And this is just a little fun thing for you, but it is also important. And let's see here. We covered that and this, and All right. So here is a little Ayurvedic constitutional test. Now, this has some real benefits, but it's also kind of trendy, and it's also kind of a source of confusion for people. But I'm giving it to you as a homework assignment to practice critical thinking. And these are links to a few of these constitutional body type tests, all right? What's your dosha? Are you Vata, Pitta, Kapha, or are you some confusing mixture of these? And the assignment is to take at least 2 or 3 and then use some critical thinking. How helpful are these? What benefits do you get from it? And what are the strengths and the weaknesses of this body type system? And we'll continue with that question next week, all right? Because there are some real benefits of knowing your constitution using this particular perspective, but at the same time, there's some real limitations of it also, okay? And I'm also going to show you another file that comes with this that gives you even more information than you frequently find. And it also links it to main categories of herbs. So, oh, the link to Nauli is here also. Yeah, I guess I put it in 2 places. So this is just a few, you know, these are the first, however many there are, 8 or 9 that I found. And a lot of them are very, very similar, but there are differences. But what you're looking for is the patterns, okay? Now what I'm going to show you is another file that is actually more detailed. These are a little bit more specific kinds of clinical Ayurvedic things that you would like to know about. And I have also put in some correlations with herbs, all right? And so this one is just the file called doshas. And these are some real classic Ayurvedic medical things. And here we go. All right. So some Ayurvedic saying, no vata, no pain, okay? No pitta, no heat, no kapha, no swelling. Well, so what are the herbs? Well, with vata, we use antispasmodics and nervine relaxants primarily. Okay, that's one way. There's more to vata than just that. But pitta, anti-inflammatories, antimicrobials, alternatives, meaning blood purifiers. No kapha, no swelling. That means lymphatic herbs, diuretics, metabolic stimulants, all right? So now I'm going to start connecting the herbs into this information more. But a lot of these body type constitutional analysis forms actually link to products and consultations. So you can follow those links also. And that way you can really study this in quite a lot of detail. That accomplishes the main goal of this course, which is how you can answer all these questions yourself, all right? So vata, old age and dryness and dehydration, and these are adaptogens, longevity tonics, blood and fluid tonics that are used primarily. Pitta, middle age, robust and sturdy. I didn't put anything in here because that's actually a fairly healthy kind of situation. Pitta people tend to heat and inflammation. And so no pitta, no heat, that group would be applicable. So you can just go ahead and scroll down through this. This will go with your constitutional analysis. Get the constitutional analysis and then plug this information into it. And then you'll start to see, all right, this is helpful. And then what does it boil down to? Vata people need warm oil, gentle warm oil massage. Pitta people need more of the cleansing and the detox, and Kapha people need more exercise. Now, here's a little interesting thing about our human nature, and that is that every constitution needs something, and every constitution is attracted to its own poison. So Vata people need heavier, richer, oilier, more nourishing foods, but they're the ones that often want to eat the salad all the time. And they're the ones who are prone to excessive detox, okay? Vata people will do excessive detox. On the other hand, Kapha people should be eating much lighter, and they should be eating more warming, spicy, stimulant diet and do more fasting and more cleansing. But Kapha people are also the ones that just love the comfort food, and they are the least inclined to do the detox. Now, this is a little bit of a stereotype, but there is truth to it. And Pitta people, they should be eating cooler, lighter foods, but they really like the hot, spicy, heavy, greasy, delicious stuff. So this is just for your consideration. And keep in mind that this is only a first draft of self-diagnosis here. All right, let me see if there was anything really crucial. We have a few things that will carry over into next week, but I think I'm going to have to stop here because I have to keep in mind that Sherry is in Toronto and it's quite late for her. And so I'm just going to go ahead and skip ahead now. And Sherry, I'll